Good morning, everybody. Good morning. Yes. On behalf of the Robert Wood Johnson Foundation and Grantmakers in Health, thank you all for being here. We are very excited about the program today. I want to take a minute for those of you who don't know Grantmakers in Health, just to say that for those of us who are Grantmakers in Health, this is the forum that brings us together to share both best practices and outrageous ideas. And the leadership of Grantmakers in Health is noteworthy for its ability to stimulate both, which, as you can imagine, if you're not familiar with health or you're new to health, getting new ideas out there, pushing the field to do what we need to do to improve the health of all of America is critically important, and RWJ sees Grantmakers in Health as an important partner and a real mover in terms of taking the field forward. We are particularly appreciative of our other philanthropy partners who are here. Thank you all for the great work that you do. As you know, we at RWJ are engaged in building a culture of health for this nation that is both sustainable and enduring. And hopefully you have all seen the new action framework that has been put out by the foundation. If you haven't, go to cultureofhealth.org, and that's all one word, cultureofhealth.org. It includes what I think of as the how are we going to know piece. So if we think of culture of health as the what, as if I analogize it, years ago people said building a culture that's climate friendly is the what. And immediately people said, how will we know if we're moving in the right direction? And the answer was, we'll look at carbon footprints. Well, a culture of health is perhaps more complex. Health is a pretty complex concept. And the foundation has tried to answer the question, how are we going to know? There are 4 domains that you will see. They are called action areas: making health a shared value, fostering cross-sector collaboration to improve well-being, so all of you being cross-sector as health and community development have a conversation today, creating healthier, more equitable communities, and strengthening the integration of health services and systems. That's the how will we know. The question, once you've said this is our direction and this is the how we'll know, that everyone then asks is, how are you going to get there? And that's why we're here. Robert Wood Johnson is committed to being a good partner and collaborator with all of you and others across the sphere of the social determinants of health in order to move the needle forward. But as we talk about how, perhaps for today in particular, it's useful to think of 6 different dimensions. And 6 is a lot, but I'll narrow it down. So, policy. How many people here, I'll continue with Faith's wonderful exercise to get the blood flowing, but this time you can raise your hand. How many people here are engaged in policy-related work? How many people are influencing planning and the sector of planning? Great. That's usually the one that gets the smallest number of hands. How many folks are working on human capital or building leadership? Excellent. And how many are working on either changing practices or improving services? Well, we have a good group. Okay. Financing or impact investing? And finally, measurement and data. And we saw earlier, lots of folks. Well, how we get to a culture of health very centrally involves measurement and data. And that's why we are delighted to be here today. What I get to do, though, to start this all off, is the best job of all. I get to introduce Annie Donovan. For those of you who have not met Annie, she is an incredibly bright light that shines from Washington. As you can see from her bio, which is in your packet on the left-hand side, she has great credentials. She was the COO of Capital Impact Partners. And if you don't know, that's a CDFI, actually a really big CDFI. And the excellence of her work led her then to move to be a senior policy advisor to the White House. So she is someone who not only understands practice, but she understands the thought world of how we translate practice in a local area to how we translate a movement across the country. She brought to that both insight and experience and began to develop a focus on data and measurement. You'll see that she next went to be the CEO of Cometrics, and I'll let her talk about Cometrics because every time I do, I don't do it justice. But when she talks about it, the excitement that she brings to it and then the excitement that you feel is extraordinary. So we'll get her to talk about it, and if she doesn't talk about it from up here, we'll push her afterward when you meet her to talk about it. And right now, we are delighted that she is currently the director of the U.S. Department of Treasury's Community Development Financial Institutions Fund. And she'll tell you more about it, but let me say, as funders, if we think we're catalytic, the CDFI Fund takes dollars that are intended to build healthy communities in this country, particularly focused on equity. And its responsibility is to channel those dollars to institutions around the country that have the ability, boots on the ground, to change stuff. So it's a big position, and she is just fabulous. So it is my great pleasure to introduce you to Annie Donovan. Thank you.
Wow, that was a very, very, very generous introduction, so I will try to live up to it. Thank you so much for having me here today. This really is pulling together 3 strands of topics that are very exciting to me. One, I love to talk about CDFIs and community development, and my job here today is to kind of level the playing field with respect to your understanding of the CDFI world and what CDFIs are doing. I love the connection to health, which I've been involved in for a long time, which I'll talk more about. And I guess I have to talk about metrics too. So I look forward to taking any and all questions you have about Cometrics. So what I'm going to do here today is just, as I said, level the playing field, and also engage with you in Q&A. I think that we are on the edge here of trying to break through to new horizons around how to bring this work together. And it would be foolish to think that any of us, especially we in the federal government, have the answer. And so we are on the path with you to figuring out what these answers are. And so engaging in Q&A is really important. I want to also just acknowledge my colleague, Oscar Gonzalez. Could you raise your hand, Oscar? He is our crack data guy. We call him the data wizard because anytime you ask Oscar a question, he will come back within minutes with data and analytics, and he's amazing. And Oscar leads up a group that we started in the past year called the Data and Evidence Working Group, and that is to turn the attention of the CDFI Fund toward data and evidence in everything that we do, and Oscar's leading that work. So for my part, I cut my teeth many, many years ago at Capital Impact Partners, making loans to community health centers. And at that time, I don't know when Primary Care Development Corporation began, but what year? 93. Okay, so I got there in 94, and we were probably the only people on the face of the earth, engaging in that industry. It's a much different picture today, and that's really great. But that was my concept in the mid-90s of the connection between health and community development, was that there were these health centers out there, these primary care centers, and they were providing services, and they were nonprofit, and nobody knew how to lend to them, and nobody wanted to lend to them. Who wanted to do the brain death of figuring out all of those sources of revenue, how they fit together, what the risk is that those revenue streams would go away. So, a few of us took on that hard work of working through the inefficiency of a market to figure out how to get capital in there. And in essence, that's what CDFIs are, and that's what they do. If you think about CDFIs from the perspective of the capital markets, and if you've had Economics 101, you know that capital, maybe even if you haven't, you figured this out, that capital moves to where it gets its highest return for its lowest risk. And a lot of communities, the communities we care about, the market breaks down because there's no flow of capital because that risk reward scenario is out of whack. And so what CDFIs do is they go in there and they're really financial engineers as well as social engineers and trying to figure out how do you work with the messy dynamic of, the formula for unleashing capital with the complexity of all the social dimensions that are going on in community and figure out how to make that all work. And that's the beauty of what CDFIs do. So along came the Robert Wood Johnson Foundation and the Commission to Build a Healthier America, and that woke us all up because we understood, and that was such a fabulous and a breakthrough study, at least for the community development field, because it defined this thing called the social determinants of health. And all of a sudden, we could see our work in a much different light. Now, it took the Robert Wood Johnson Foundation in collaboration with the Federal Reserve, and the San Francisco Fed really led this, and then other feds joined in, and having this conversation. It was a very funny, the first conversation. Some of you may have been there, where we started talking, the public health people stood up and they started talking about CDCs. And we're like, what do they know about community development corporations? Of course, that's what CDCs meant to us, but we figured out it's not what that meant to them. So, so after we got over the sharing of nomenclature, we started to realize that there really was a very profound connection, and if we could work out how to pull these worlds together, we would all be better off. And I think the theory of change here is that that community development financial institutions are providing capital, but the way in which we provide capital and the things we provide capital to, we could think more deeply about what the health impacts are of that. And on the health side, if you could understand that there are these agents out there in community trying to figure out how to make these pieces work, and how does delivering capital to organizations that are doing the work on the ground, you can imagine how that's going to be helpful. And as grant makers as well, I think over the past 5 or 10 years, 10 may be stretching it, but that the grant makers who have figured out how to use CDFIs have really come up with some very interesting, innovative projects that are driving capital toward these solutions. So let me start by telling you a little bit about the CDFI Fund. We are part of the U.S. Department of Treasury, and our primary purpose is to encourage the creation and expansion, and to expand the capacity of community development financial institutions. And these are specialized institutions that provide affordable capital, credit, and financial services to low-income communities. And I like to say that CDFIs work at the intersection of people and place, because the CDFIs have a core mission of providing economic opportunity, and we know that that can't be accomplished by the physical redevelopment of place alone. And we've learned this over the past 2 decades. When I came into the business, urban areas, the urban core was really very, very dead in terms of investment, and now it's very alive in terms of investment, and yet that's not alleviating poverty. It's, we have to care about people and place. And we know, I think, from the research that Raj Chetty has done and reevaluating the Moving to Opportunities program, that he's figured out, or the researchers have figured out, that there is an interplay between place and mobility. So we have to pay attention to both. But in 1994, that's when the CDFI Fund was created. There were about 200 or so what we identified as CDFIs. And CDFIs come in many forms. A CDFI is not one institution type, it's many types. So there are for-profit CDFIs, there are nonprofit CDFIs, there are regulated banks, regulated credit unions, unregulated loan funds, unregulated venture capital funds, micro funds, and we are agnostic. We don't care if you're nonprofit, for-profit, regulated, unregulated. We see value in all of these different types of tools. in serving low-income communities. So today there are 1,000 CDFIs that we certify, and they're headquartered in all 50 states, the District of Columbia, and the territories, Guam, Puerto Rico, U.S. Virgin Islands. So we have covered the map in terms of where CDFIs are located. And the activities that CDFIs support also we're agnostic to, and they range very, very widely, from affordable housing to small business to micro business to consumer goods and services, financial services, and community facilities, including health centers, long-term care. So a whole range of activities gets done by CDFIs. In addition, to be certified as a CDFI, you also have to offer development services alongside your lending. And this idea came into the statute because of the practice that was already out there, that in communities where people may not be, people have to be ready to accept capital and use it responsibly, and the capital itself has to be priced responsibly and structured responsibly. And it's interesting that that concept was already in play in 1994, before we just had a financial collapse and the rise of shadow banking system and predatory lending and all of that. But I want to tell a little story that I think is very, very hopeful, because not too long ago, Standard & Poor's, which is the rating agency for Wall Street firms, rated its first CDFI. And it rated it a AA, and that was so exciting. I got so excited, I called them up and said, can you come and talk to us about why you did this, what you saw? And they came in, and the analyst who worked on it said, what we did was we basically looked at a couple organizations. They were primarily housing organizations. And they had this public finance portfolio that looked to them a lot like what the CDFI was doing. So they used that as their sort of data that would tell them how to evaluate the CDFI. And then they said, we looked at the public finance agencies and we compared it to the non-public finance agencies that were doing all this bad acting during the sort of created the crash. And we gave a positive evaluation to the mission side of this, which kind of floored me, because after 25 years of working on this and knowing the value of mission but not having that recognized anywhere in the financial world, all of a sudden here's this analyst who figured it out, that the mission side of this actually reduces risk. And it's a big opening, I think. And now a few other CDFIs have gotten S&P ratings, and there are more in the pipeline. So I think that's a very great thing. And the way that potentially ties to the portfolio of a foundation is that a lot of foundations have been trying to figure out, how do we do more social investing from our corpus rather than just from the 5% payout, and being able to invest in a rated entity is an important standard that your chief investment officers use to figure out where they're going to put that endowment money. So it's a very important development. So back to the idea, though, that this mission component to it and this evaluation and offering of development services really does add value in many, many ways that are both social and financial. The CDFI Fund also has a number of training programs that we offer, and we have, in the area of health, in the past several years, have focused on healthy food financing and also health center lending. So we play that role of being able to, once a CDFI or two figures something out, to bring them into our capacity building work and spread that practice across CDFIs. And just to give you a sense of size, so since 1994, the CDFI Fund itself has invested $2 billion in certified CDFIs. And that has to be matched by the CDFI one-to-one. And then beyond that, CDFIs use our capital because we are a balance sheet funder. We don't fund projects. We don't fund programs. We fund organizations and institutions. So we are helping to build their financial health. So when they get our capital, they oftentimes will put it into the riskiest parts of their business. They'll put it into loan loss reserves to go into new markets, or they'll put it into, they may be testing a new product. And so this money will enhance that activity to protect, a private sector investor who wants less risk. And that money stays there and over time grows, and its impact grows over time. So in that way, we are a very unique funder in the federal government. In fact, even 20 years into it, we're still very innovative, and we just went through a round of changes that OMB initiated to standardize grant-making practices. And, it's still hard because we don't see ourselves really as grant makers, we're investors. So some of the treatment is just not the same as when you're funding a budget where the money is going out for operations. But that's okay. We're still delighted to have the flexibility that our funds bring to the organizations that we finance. So the CDFI Fund also has several other programs. In the core program that I just described, several years ago, this administration put forward a proposal that was granted by Congress to do a carve-out for healthy food financing to address food deserts. And through that program, to date, we've awarded $116 million through HFFI. And that money is going to support many forms of healthy food provision. So grocery stores, farmers markets, food co-ops, urban farms, production, distribution, retail, sort of all phases of the value chain are being addressed by CDFIs. When I was at Capital Impact Partners, we used this funding to create the Freshworks Fund in California, which the California Endowment invested in from their corpus, as well as their grant pot. And we created about a $250 million fund to focus in California communities in food deserts. In addition, we have this program called the New Markets Tax Credit Program. And this program is available to CDFIs and community development entities, and it's a broader program. The threshold isn't quite as high to be a CDE in terms of the mission. In the CDFI program, 60% of your assets have to go toward low-income target markets. We don't have the same requirement in the New Markets program. It's a very big program. So it started in 2000. To date, we've put out $43.5 billion in tax credits, and those tax credits. I'm going to show you some data in a minute about where that money has gone. So actually, why don't we pull up the map, and you can see. So this is a map we ran of just the health center lending and healthy food financing that CDFIs have done since 2003. And it's about $1 billion that has been invested in health centers, and almost $100 million in healthy food financing. So this isn't the whole universe. This is an undercount because we just looked at these two segments. And there's a lot more activity that's sort of crossover activity that doesn't get captured here. But you can see that CDFIs are already in a lot of places doing a lot of work. So in a way, the pump is primed here. So this gives you a sense of a couple examples of some deals that are on this map. So in Brockton, Massachusetts, for example, there's the Brockton Community Health Center, which is an FQHC, and they've expanded several times using new markets tax credits, and there are a lot of CDFIs that have been involved in that. The most recent expansion, because every time they go into a facility, they think it's going to be huge, and there's no way, did they, have they made a mistake? Is their footprint too big? No. They fill it up immediately, and they, had to go back at it again. And this last investment is coming from the Kresge Foundation, JP Morgan Chase, or Morgan Stanley, alignment to create the Healthy Futures Fund. And that was a $100 million fund, and they invested in not only the expansion of the health center, but right next to it there's HFFI dollars going into a Cape Verdean, locally owned, family owned grocery store that then connects, culturally, it connects geographically, and it connects programmatically, where, the folks in the health center can not only talk about nutrition, but they can, point people right next door. And the folks next door can not only provide the food, but the cooking classes and the education around it. So it creates a synergy that just makes creating the culture of health all that, easier. In addition, projects like that are, they're economic anchors in their community. So they're not just providing physical health, but they're providing financial health as well. They're creating jobs. They're creating jobs that have ladders of opportunity for people to move up. And so these are really creating virtuous cycles in communities. Another example is Bridge Housing in San Francisco, created about a 150 unit mixed-use affordable housing. They're an affordable housing developer and a large and successful, one of the biggest nonprofit affordable housing developers. And in that development, they built into the ground level a Head Start facility as well as a health center. The Mission Neighborhood Health Center put a site right there. So, so you have childcare and you have healthcare and you have housing targeted to a low-income population that's all right there on site. And again, you start imagining how when you co-locate like that, then you can really start changing behavior. And behavior is sort of the underpinning, right, of a culture of health. So now that CDFIs see the connection between health and community development, they're looking for more and more ways to advance both of these in tandem. So here are a couple of the ideas. I'm just going to throw out two ideas that I think are very cutting edge and I think are very exciting. So you may have heard about this thing called social impact bonds. And they are financial instruments that are meant to put government actually in a little different role. The idea is that you have an intervention and you can prove that it works, and a private sector actor comes in and finances it, or it could be, a foundation that finances it up front. And if the evidence is there that the intervention worked, then the government is the payment source. They're the payout source. And I didn't like this idea at first when I was in a CDFI, because you're used to underwriting real estate and you have, there's a cash flow stream that you're underwriting that's being generated by some activity, and there's collateral. In this case, you're financing an intervention, and it's not something that comes with a revenue generating stream or assets in case there's a loss. But once I got to the White House and I was working on this and saw the problem from the perspective of government, it is quite a powerful intervention, because part of the problem is knowing, when you're on the policymaking side, knowing that an intervention works and not having the tools, or having only one tool or a very limited set of tools to actually make it happen on the ground. So if you can't get Congress to, say, agree on a budget or agree to fund something. This is an innovative way of demonstrating the power and the outcomes, and allowing the social sector to help demonstrate that. And it's just easier to swallow if you're on the government side that you're actually funding success. So still lots of problems with it, but in California, the California Endowment has invested in this concept in the Central Valley of, it's an asthma reduction technique that is the payout is in reducing the expense of having kids go to the emergency room to take care of their asthma needs, and when they can be taken care of if you have the proper environment in your home. So it's a housing loan that has a health outcome that saves the public money. So that's very, very exciting, and it's still in the works in terms of, looking at feasibility and implementation and all of that. But I think there are things that we know, and what we need to do, what this tool can help us do, is really hone in on what are the factors that lead to success. Is it that you pulled up the carpet? Is it that you have, better air circulation? Is it sunlight? What are the factors in the intervention that make it work? And it helps us to be more precise about what we should be funding. So that's underway in California. Another project that I saw that I got really excited about over the summer when I was out on a listening tour is a project being invested in by many, many organizations. This is the redevelopment of Potrero Hill, which is 1,000+ residents in public housing, in housing that's 40 years, was built as temporary housing, was only supposed to last 10 years, and 40 years on, people are still living there, and it's a very geographically isolated, so Bridge Housing, again, is working with the city of San Francisco. This is part of an initiative called Hope SF. And they're redeveloping it into mixed income housing. And what they're doing, they started years in advance of the actual physical redevelopment of the site, funding a program called Trauma-Informed Community Building, where and I see some nods around the room, so you know what this is, right? It's addressing the social side of the redevelopment of a place, so that the social and the physical are going to work better hand in hand. So some very practical things like the mobile school bus, where kids a couple days a week walk to school in groups led by an adult. Zumba classes or walking clubs for adults. The interventions are not fancy. But they're repeated and reliable, and so that's to me, a very exciting development, that the CDFI coming into this saying, yeah, we're not just about redeveloping place, we're about redeveloping or attending to people as well, and how do we make those work in tandem. So those are some of the things that I think are exciting and that we're just on the verge of, and certainly from the perspective of the CDFI Fund, very excited about. And in the example of Potrero Hill, the way that LIF was able to do this is by being an aggregator of lots of different types of resources. So they're aggregating from the likes of banks who have a certain return expectation and a risk tolerance, and they're aggregating from those, whether it's foundations or bank foundations have actually gotten a lot more active in the space, and they're taking the softer money and taking the higher risk on the kind of activity that we were just talking about here. So they're also, what they've built into this program is a set of metrics. So over time, if you want the money, you have to agree to create the data and report it. But somebody from LIF is here. Yes. So you can talk more. You can correct all my mistakes and what I what I just said. But it's a very exciting exciting initiative. So so let me turn and talk for a minute about data because you know, I did spend, when I got to the White House, one of the things I was focusing on was evidence-based policy and the need for better data. And so I went and spent a year at Cometrics, which is an organization that creates, collects, and organizes data that comes from disparate sources, from disparate accounting systems, pulls it all together and standardizes it with the technology standardizes it instead of having humans on the front end of it have to use standardized forms. And then from there, you can, once it's standardized then into a common chart of accounts, you can start benchmarking and really digging into understanding your business in the context of other businesses. And it's a very, very powerful tool that we aspire to create similar kind of mechanisms inside the CDFI Fund. We've been talking about, you know, once we're able to better standardize CDFI data, that what CDFIs really want to see from their data is how they compare to their peers, and it helps you identify where are the best practices. So when I came to the CDFI Fund, I was already primed to want to do something with data, with our data, because the CDFI Fund is a compeller of data. So we're in a very powerful position in that sense. We have to collect data for compliance purposes, but data is now a strategic asset. And it's an asset for everybody. It's an asset for us. It's an asset for the field. So how do we turn what we're doing into the management of an asset rather than just compliance? So we're really, this summer, as I mentioned, I did a listening tour and went around to 5 different cities we had 6 areas of inquiry. One of them was around data. And so we heard a lot from the field about the state of practice. And I would say that we have gotten really good at the CDFI Fund in terms of being able to tell you where all of our investments are on the map. So we can say who invested, how much they invested, where it is. They're geocoded. But we can't tell you to what end. You know, so we are exactly where everyone else is, which is why I'm excited that this is a conversation. But we are positioned to want to learn side by side with you, and I think we can play an important role as a compeller of data. But we also can play. We could also be very detrimental if we don't do it right, because we could cause a lot of pain. So we are very interested in figuring out what the tools are, how we contribute to understanding really what are the outcomes of the work that we're funding. And in the long term, we need to be able to do that to justify our own existence. And not only that, to increase the resources that are at our disposal. So I am going to, with that, just kind of open it up to your questions. For me, part of the reason for the listening tour was to help me gather a lot of information from the field about and create strategic directives. And one of them, we're still working on what those will be, but one of them will certainly be around data and evidence and how we can support the infrastructure that's needed to do better measurement. So I'm very excited for this discussion, and so I'll open it up now to questions.